Now, just as a reminder, I want you to look at the relationship between the hypothalamus here, which you said is the center of coordinating homeostatic functions, and also coordinating the other the roles of the hormone, but of course through the pituitary gland. So you see, the pituitary gland is divided into two lobes, that is the posterior and the anterior. The posterior lobe secretes oxytocin, and then antidiuretic hormone. Both of these hormones we have mentioned them in the previous clip. Remember, oxytocin for muscular contraction during birth, antidiuretic hormone that is stimulating the selective reabsorption of water back to the bloodstream in the kidney. Now, on the anterior part or the lobe, the anterior lobe secretes the thyroid stimulating hormone, TSH, thyroid stimulating hormone. It also secretes a hormone that is referred to as adrenocorticotropic hormone, ADCH, and then the somatotrophin, which is a growth hormone. You also have the LH, luteinizing hormone. Remember, this one enhances the development of the Graafian follicle, apart from just enhancing the process of ovulation. That is the release of a mature ovum once in every month. That is in the females. Then the follicle stimulating hormone, follicle stimulating hormone, FSH, and then of course prolactin. So it is important for you to note that the pituitary gland produces at least 8 hormones, but the 8 are not produced by one lobe. Selectively, some of the hormones are produced by the anterior lobe, whereas a few of them, that is the 2, oxytocin and antidiuretic, are produced by the posterior lobe. Remember, the posterior lobe is the hind part, the anterior is the front lobe. Now, let's look at a thyroid gland, what they secrete, and what will be the effect if they over-secrete the hormone in question, which is thyroxine. So we say that the thyroid gland is located on the section of the trachea of the windpipe, and you can see the thyroid gland here, this diagram, and the relative to positioning of the other structures. For example, the voice box, that is the larynx, and then the air passages, that is the trachea. Now, thyroxine, under normal situation, when it is produced in sufficient amount, that is as needed, it has several functions. One of the role is to regulate the rate of metabolism, which is necessary for normal physical and even mental development. That means that if it is produced in insufficient amount, there could be cases of mental deficiencies. Number 2 role is that it enhances the effect of growth hormone. Therefore, once it is produced, it stimulates the production of the growth hormone, of course, by the pituitary gland. And then it also improves on the action of adrenaline. What will happen if there is insufficient production of thyroxine in what we call hypothyroxism? This might be caused by lack of iodine. Remember, iodine is needed for purposes of formation and development of the thyroid gland, and therefore, if there is a defective enzyme reactions, that could result to deficient secretion or production of the hormone. So in young children, very young children, it leads to a condition that we refer to as cretinism. Now, cretinism is characterized by 1, retarded growth, deformed legs. Those legs could be bow-legged, and therefore they are deformed, having the shape that may not be able to support the other parts of the body. Then the dry, leathery skin, poor mental development, And whereas in adults, it leads to a condition that we refer to as myxedema. And myxedema is commonly signified by goiter, which is the swelling of the thyroid gland. And but apart from goiter, there are other features here, or symptoms that might show insufficient secretion of thyroxine, for example, puffy eyes, low breathing rates, and then edema, amongst others. Remember, some of these you'll be able to get them in the notes that we shall accompany to the video. Now, oversecretion of thyroxine is also very harmful. This condition is referred to as hyperthyroidism. This may be caused due to overactivity of the thyroid gland as a result of defective enzymatic actions. Now, this may lead to nervousness, quick irritation, and then loss of weight, protruding eyeballs, heart failure, especially in extreme conditions. So these are some of the few symptoms that can show hyperthyroidism. Now, these symptoms or these conditions may be controlled by, number one, for oversecretion of thyroxine hormone, one could be subjected to treatment with radioactive iodine and then followed up by surgical removal of the parts of the thyroid gland that is overgrown, and then some part of the overactive thyroid gland can also be sliced off. It can be cut off. However, these processes must be done with a lot of caution, because remember, there is that closeness with the windpipe, so that such structures are not damaged. Therefore, they must be done by experts. Hypothyroidism might be caused, or we said it is caused by maybe enzymatic defects that might make the thyroid gland not secrete sufficient amount of thyroxine hormone. This situation can be controlled by ensuring that we take balanced diet that is supplemented by iodized table salt. Remember, it is always recommended that the table salt are prepared having some iodine in them. Of course, it is to check out this issue to do with goiter. Now, this diagram here can be able to show a swollen neck region due to overactive and overgrown thyroid gland. You see, this swelling is a symptom of insufficient production of thyroxine, especially in adults. Now, the other diagram can be able to show the other section of the other part of the hormone, which is produced in the thyroid section. That is the parathyroid, which is embedded in the back of the thyroid gland, and then it produces the parathormone, whose role is to regulate metabolism of calcium in the body. Amongst these other roles that are accompanied here, for example, after the absorption of calcium ion, it is the same hormone, that is parathormone, that promotes its reabsorption in the nephron. And then also it stimulates the release of calcium ions in the bone tissue, especially when the levels of calcium ions in the blood falls below normal.